Gas gangrene is caused by Clostridia species, which are gram-positive, anaerobic, and produce bulging spores. So out of the species, the Clostridium perfringens is the most common cause. So these are obligate anaerobes, and these produce subterminal spores, you can see in the picture, and these are capsulated, non-motile, found in the soil, dust, and they're saprophytic. So this gas gangrene also known as malignant edema, because you can see the edematous conditions, and clostridial myonecrosis, because the death of the muscle tissue occurs here. So definition, it is rapidly spreading edematous myonecrosis occurring in anoxic conditions. Anoxic is nothing but anaerobic conditions due to infiltration of Clostridium perfringens. Etiology can be caused by Clostridium perfringens, Clostridium novae, specticum, or tertium. Toxins of Clostridium perfringens are alpha toxin and theta toxin. Alpha leads to the occlusion, theta causes vasodilation. So coming to pathogenesis, gas gangrene is most commonly caused in traumatic conditions, and sometimes non-traumatic conditions can also lead to it. So talking about traumatic conditions, in case of road accidents or any severe fractures, there will be crushing of the muscle. So it creates ischemic conditions. That means there will be no oxygen supplying to the underneath tissue. So in that case, the lactic acid production occurs anaerobically. So these conditions are very favorable for Clostridium species, especially Clostridium perfringens, as it is an obligate anaerobe. So contamination by the Clostridium perfringens occurs, which leads to the gas gangrene. But in case of non-traumatic conditions, this Clostridium perfringens from colic reaches to the muscle through the blood. This can happen in cases like colic malignancy. So major toxins released by Clostridium species are alpha, beta, gamma, protease, and septolysin. Clinical features: sudden and severe pain, foul smelling, gas bubbles are crepitous in nature, edema and induration can be seen, rapid progressive necrosis occurs, granulomatous tissue gets liquefied and sloughed off. Fever, hemolysis, toxicemia can occur, shock and organ failure in severe cases. Lab diagnosis: collect the specimen and observe it under the microscope. So specimen can be collected from muscle fragments, necrotic tissue or the exudate. Under microscope, you can find the thick, stubby, gram-positive bacilli. Or in case of Clostridium perfringens, you can observe the subterminal spores. Transport media is Robertson cooked media or the egg yolk agar. Incubation: anaerobically incubated by gas pack. For identification, this is an important part of lab diagnosis. So under identification, you have 4 tests. One is target hemolysis, the Naegler's reaction, heat tolerant test, and the litmus milk test. This is a picture of gas gangrene. You can see the black color bubbles, which are foul smelling, crepitous in nature, and these are severely painful. Coming to Naegler's reaction, in the above picture, you can see a round plate, which is egg yolk agar. It is rich in lecithin. Now onto the egg yolk agar, add the Clostridium perfringens species. Now divide the plate into 2 halves. The first half, we do not do anything. That means we just keep it the way it is. Onto the second half, we add anti-alpha toxin. So now before we go further, this Clostridium perfringens species has alpha toxin, right? The speciality of alpha toxin is it has lecithinase property. That means it can degrade the lecithin and produce turbidity. So what is meant by antitoxin? It's like an antidote for the alpha toxin. So the expression of the alpha toxin, it creates turbidity, but the antitoxin prevents it from creating turbidity, right? So it cancels out the action of alpha toxin. In the first half, we did not give any antitoxin, so the turbidity is produced, right? So on the second half, we did give the antitoxin, which inhibits the turbidity, which opposes the action of alpha toxin, because it is opposing anti-alpha toxin opposes the alpha toxin. So this is in the picture you can see, in the first picture you can see the opalescence or the turbidity produced by the alpha toxin. In the second picture, the turbidity or opalescence is not seen because it is inhibited by the anti-alpha toxin. So it detects the lecithinase activity. It can be grown or inoculated on the egg yolk agar or the human serum which contain lecithin. It can be incubated anaerobically at 37 degrees for 1 day. Colonies of perfringens are surrounded by the zones of turbidity due to the lecithinase activity of alpha toxin. Clostridium perfringens produces opalescence due to the lecithinase activity. Opalescence inhibited by anti-alpha toxin. So litmus milk test is another identification method. In this you can see the Stromy cloth reaction. Heat tolerance test is positive. So in the Robertson cooked media, you can incubate the species, the colonies at the 45 degrees for 4 hours and still they grow. Target hemolysis, there will be double zone formation on the blood agar. Inner complete zone is formed by the theta toxin, outer incomplete zone is formed by the alpha toxin. So treatment, early surgical debridement. So hyperbaric oxygen kills obligate anaerobe perfringens, right? Because obligate anaerobes, they cannot grow in the oxygenic conditions. Penicillin plus clindamycin is given for 10 to 14 days, and anti-alpha toxin serum can be given as passive immunization.